Here's my audience. Many of y'all have probably heard of the hit movie Split, where a killer has two personalities and the nice one doesn't remember kidnapping two girls. Many people believe this is what DID, or dissociative identity disorder, looks like. But it's not. Today, I will explain how DID develops, its biological effects, and the treatments available for managing this disorder. Understanding DID is crucial. Through examining these points, we can gain a deeper understanding and appreciation for the challenges that this disorder brings and the importance of appropriate treatments. To understand how DID develops, let's first discuss the early childhood experiences and genetic factors that may cause this disorder. We must start all the way back at birth. A common myth that many people believe is that therapists are actually the reason that DID exists. They believe that therapists implant memories of different personalities into people's minds and make them believe that they have this alternate personality that doesn't actually exist. Now, this has been proven wrong by countless studies, and many people have shown that DID is a real disorder that is developed in childhood. Children grow up with 4 different attachment styles: secure, avoidant, anxious, and disorganized. People with dissociative identity disorder typically grow up with a disorganized attachment style, which means that they have a lack of strategy for dealing with stress due to their parenting being inconsistent. This means that the parent may frighten the child at the same time as frightening the child. This causes a paradox in the child's mind, making them believe that they are helpless at the same time as threatening. From there, the child will grow 2 models of self, in which one of them they shut down. This shutting down is known as dissociation. If they then experience trauma, they will use that dissociation as a coping mechanism. This begins to create an alter. An alter is a separate personality that the person goes into in a time of high stress. The separate personality has different memories, behaviors, and personality. They have an alter that deals with high stress, and then their host. Their host is what they typically express when they are not in high stress situations. Even though nurturing plays a huge role in the development of this disorder, genetics also come into play. According to an article published by Lakatos in the National Library of Medicine in 2000, infants with a specific allele in their dopamine receptor gene are 4 times as likely to develop a disorganized attachment style, which, as we know, can lead to dissociative identity disorder. Through the trauma an affected individual must endure in childhood, consequently, the development of the brain and body are severely impacted. Through experiments and studies, doctors have been able to discover that the brain of a normal person is extremely different than that of a person with DID. According to Sean Manton, in a Boston University article written in 2011, there is decreased functioning and irregular development of the orbitofrontal cortex. The orbitofrontal cortex, or the OFC, exists right here in the prefrontal cortex and at the bottom. The OFC controls decision making. Since it has delayed development in DID patients, they have an increased ability of being impulsive. This impulsivity causes them to act out and be irrational. They have also found that there are reduced volumes in the amygdala and the hippocampus. The amygdala exists right here in this little pink spot, and the hippocampus exists in the white spot underneath, labeled as D. In the amygdala, we can see how the differences manifest visually through their coping techniques. People with DID cannot cope like a normal human would. They instead cope by shutting down, dissociating, and switching into their alter personality. Now, the hippocampus, again, right here in the white spot labeled D, the hippocampus controls long-term memories. We can see how this manifests in them switching alters, and when they switch alters, they do not remember what happened in their other state. Unfortunately, these results were also shown in patients with PTSD, so it is hard to determine whether PTSD or DID is causing these differences in the brain, as most people with DID also develop PTSD from their childhood trauma. DID causes lasting developmental effects on the brain, leaving no cure for the disorder. However, I will now describe the types of treatments that may help an affected individual reduce their symptoms and better operate in society. According to Cleveland Clinic, in an article last reviewed in May 2021, the most effective treatment is psychotherapy. Psychotherapy has a bunch of different benefits, but what they mainly focus on is identifying and working through past trauma, as well as managing their behavior and outbursts. And in severe cases, they will attempt to put the different alters into one personality. This can take years and years of work, but if done successfully, it can help improve their quality of life by a bunch. Another type of treatment is hypnosis therapy. Patients with DID are shown to have to be more hypnotizable than those of a regular human, making this treatment an effective form of therapy for people with DID. Medications can also be given to patients with DID. It won't cure the disorder, however, it can help cure symptoms of the disorder, such as anxiety and depression. Now that you have a better understanding of dissociative identity disorder, please allow me to recap these points again. Dissociative identity disorder is a condition that comes from childhood trauma and genetic factors. It greatly impacts brain development and functioning, leaving those impacted with severe symptoms. While there is no cure, treatments such as therapy, hypnosis, and medications can improve the quality of life for individuals with the disorder. Thank you for listening and your attention towards this issue. And here is my audience again.